Hi, Casey.
Hi.
So I see in your chart you've been having some back pain.
Yeah.
Can you tell me more about that?
Yeah, it started, I would say, like 3 weeks ago.
Okay.
It's a lot of pain in my joints, on the right side a little bit more than the left, but
Okay.
it's like pain when I move, but also an aching pain just when I'm laying there sleeping.
Okay. Is this your upper back and shoulder?
Yeah.
How far along does it go down the back? And I'll be inspecting this, but would you say it radiates down to the midsection, or does it go to your lower back?
It honestly goes all the way down to the bottom of the spine.
Okay, so your sciatic nerve could be affected. Do you remember anything that happened that might have incited this? Did you move any large object, or?
I've been starting to work out, so I can't tell if I might have sprained something at the gym.
Very well could be. Have you been lifting weights?
Yeah.
Okay.
Nothing crazy heavy, though, which is why it surprised me.
Sure. Well, when your body's not used to those repetitive movements, sometimes it reacts in a way that compensates for the extra stress that builds up. So you're going to have some weird, wonky feelings. And hopefully it's superficial and there's no nerve damage, but I'm going to do a full assessment on that.
Okay.
Any changes to your sleep routine? A new mattress? Anything?
No, but it has been making my sleep harder.
Oh, I'm sure. Have you been taking any over-the-counter medications?
I've been taking some ibuprofen for it.
Okay, how many milligrams?
Whatever the size of, I would take like 2 capsules a day.
Sure, the standard is 200 milligrams, so you take about 400 milligrams a day. All right, well, I'm going to go ahead and begin. I'm going to start by palpating your neck, shoulders, head, everything, and then I'll move on to assessing your joints. Okay?
Okay, thank you.
Okay, perfect. So just relax. Just feeling for any physical lumps or bumps. I know you're going to feel soreness as I palpate, but let me know if you feel any sharp shooting pain that just comes out of the blue, okay?
Okay.
Right. Just feeling along the scalene muscles and the deltoid back here. Okay. Do you feel soreness here?
Yeah, I do.
Okay, so you say it goes straight down your back?
It does.
Not so much to the side.
A little bit.
Kind of
but
all
not,
over.
Not as much, yeah.
Okay. Alright, I'm going to go ahead and do some simple movements with your arm, and I want you to let me know if you feel any pain.
Okay.
Okay, so just move your arm up straight in front of you.
It's definitely uncomfortable.
Okay. Okay. Alright, now I'm going to bend it inward. Let me know if you feel pain there.
It's uncomfortable.
Okay. Okay, I'm going to go ahead and, sorry to do this, but I'm going to be doing those same manipulations again just so I can listen to the joints. Okay. So go ahead and reach straight outward. Okay. Okay. Definitely feel a bit of crackling. Okay, I want you to do that again. Okay, now just move back inward. Good. Okay. Send your arm here. Alright, I'm going to be listening as you bend your arm in. Okay. Okay, that actually sounds normal. I'm going to be listening to your wrists and just slightly rotating it. Okay. Okay. I'm going to be doing some percussions just to feel for swelling.
Okay.
Great. And I'd like you to extend your hand forward here. I'm just going to make some strengthening tests. Okay, so I want you to, I'm going to put my hand here. I want you to apply pressure against my hand. Try to bring your hand down.
Okay.
In 3, 2, 1. Okay. Was that the most effort you could extend?
No.
You do a little more?
Yeah.
I don't want to hurt you, but try your hardest to push my hand down.
Okay.
3, 2, 1. Okay. Good. All right. Now the opposite. So I want you to try to raise your hand. Okay. All right. Any pain there?
It's uncomfortable
Yeah.
still.
Yeah. Okay. Next, I want you to try to bring your arm inward. I'm not going to let you do that. Good. Now bring it outward. Okay, good. And now I want you to raise your hand as high as you can go, and if it gets to a point where it's uncomfortable, definitely stop.
Okay. And probably right there.
Right there. Okay, so that's definitely something that we're going to looking into your limited mobility range. I'm going to ask you to do that one more time, and this time I'm going to listen. So
Okay.
go ahead, and when you can't, stop.
Right there.
Okay. Definitely some disruption in the deltoid muscle. All right. Go ahead and see your hands. Pain here?
No.
Okay. Pain here?
No.
Okay. I'm feeling it to feel popping in your wrist here. So it seems like the joints are stressed. I think it stems from that back issue. Okay, go ahead and squeeze my fingers as tight as you can. Tight, tight, tight. Good. Okay. So I want you to go ahead and make your hand into a fist, just like that. Now spread your hands as wide as they can go, or your fingers. Good. I want you to do that a few times, and just as quickly as possible. I want to see how quickly your mobility. Okay. All right. Very good. You can go ahead and relax that arm. Okay. I'm going to do the same assessment on the opposite one.
Thank you.
Pain there?
Definitely tender.
Okay. All right. Go ahead and bring it back down. All right. I'm going to listen. Okay. Bring it back down. Sorry, I'm going to have you do this a few times. Okay. Why don't you keep your arm right there and move your hand inward. Good. ahead and extend your arm again. All right. Now try to move it in towards yourself like you're doing a little plie. Good. Okay. Can you go a little harder? Just want to test. And that was difficulty in doing that?
It was, yeah.
Okay, so it truly is the right side that is the most affected. I'm going to have to ask you to push your arm the opposite way. Push your arm out.
Okay.
3, 2, 1. Good. Good. All right, I'm going to press against your hand. I want you to try to raise it. 3, 2, 1. Okay. All right. All right. Okay. Go ahead and take this hand. I want you to just like hold it out like this. All right. Try to pull me towards you. Okay. Now try to push away. All right. Let's do it with that other hand since we missed it. Pull me towards you. Push away. Good. All right. I'm going to go ahead and take a look at this hand and the joints in your wrists. Pain here?
Yes.
A little bit radiating up?
Yeah.
Okay. And one more movement before I go to your knees. I want you to try to move your elbow backwards like you're like doing a victory.
Okay.
Okay. 3, 2, 1. Okay. Now push it outwards. Okay, let's do the other arm. Go ahead and move it back. Okay. And push it outwards. Okay, so I am seeing some strain and limited mobility, just doing simple movements. So it's definitely going to be an issue. I'm going to, I know you said that it's not radiating to your feet, or did you say?
No, it's not.
It's just the lower back?
Yeah.
Okay, well, sometimes the alignment can be thrown off, so you might not be noticing something now, but when you pull something, especially in your sciatic nerve, it can be totally throw off your gait and put strain on your feet. So I'm just going to do a quick check of those joints, and then I'm going to move on to your back, and hopefully we'll get you feeling better.
Okay, thank you.
Okay, I'm going to do some initial palpating here, and again, let me know if you feel any sharp pain.
Okay.
Okay. Okay. No muscle protrusions so far, which is good. Okay. 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 All right. I want you to try to extend this leg all the way. Can you?
Yeah.
Okay, now bring your ankle down and 3, 2, 1. Okay, good. Now bring it back down and try to push up your leg in 3, 2, 1. Okay, good. That seems regular strength down here, which is consistent to what you say. I'm going to listen to the knee joints real quick. Okay. Okay. Okay, and again, try to raise your leg in 3, 2, 1. Good. Now extend it all the way up. Try to lower it in 3, 2, 1. Okay, good. Good. Okay. So I want you to try to bring your ankles in toward each other in 3, 2, 1. I'm not going to let you do that. 3, 2, 1. Good. Now try to extend them outward. 3, 2, 1. Okay. All right. So what I'm going to have you do now is go ahead and we're going to get you on your back, and I'm going to just do some spinal tracing, some measurements of the spine, followed by some cupping and some just massaging treatment just to smooth out those nerves. Okay.
Thank you.
Okay. I'm just going to be palpating. I do see you definitely have some irritation in your triceps lateral along with the deltoid muscle. I want you to go ahead and can you take your arm here and try to reach the center of your back? This just highlights that muscle for me so I can. Okay, thank you. Go ahead and do the other side. Okay. Right. I'm going to be doing some tracing along the spine just to map out your spinal column. All right, so I can make some measurements to make sure that it's symmetrical, that your spine isn't tilting to one side or the other, okay? So just relax. Okay. Just tracing along the center with this surgical pen. Okay, good. Okay. Taking some measurements here. Just here, so just writing that down. Okay. spine seems to be slightly shifted to compensate for this injury on the right side, which is our natural response to a sudden impact injury. Okay. Discrepancy here. And I do have it continuing on to the section of the back. Okay. And this is 8 centimeters. Okay. What I'm going to do is apply some ointment to your back, and with a gua sha tool I'm going to go ahead and smooth out those muscles just to relax your muscles on a cellular level and get the blood flowing so it can be more receptive to the cupping treatment and also skin pulling, okay?
Great.
And again, let me know if you feel any very sudden intense pain.
Okay.
All right. Okay. And you're going to have some redness from the ointment as well as from, well, not the ointment, from this movement that I'm doing, as well as the skin pulling and cupping, but that's natural. That's the skin's response. It means that the blood is moving throughout. Okay. Really paying attention to the scalene muscles. Right here is where you definitely have the most impacted strain. So that's what I'm kind of focusing on here. Okay. Great. And I use for a cupping tool, as along with this traditional use, is as a massage tool. So I'm just going to take that area along the spinal column that I traced and extend outward just to get the blood stimulated. Quicken the healing process and kind of reset your spine alignment from all that tension that you've been storing. good. Going to do some light traditional cupping just along these upper two quadrants. So and you should feel at present just a general warmth in the area that I did the cupping. You're going to see some spots. That's completely normal. They're going to fade within a day. Very good. Okay. I'm going to go ahead and wipe off the residue from the oil and do some skin pulling, okay? All right, putting on a new pair of gloves here. And I'll be pulling the skin. Okay. Now I have received extensive training on this, but if you feel a pinching as opposed to a pulling, please let me know. It shouldn't feel like I'm pinching the skin. It should just feel just like a pressure being released, okay? All right. Okay. Okay. Okay, Casey. This is all of the treatment that I want to do today. How do you feel right now?
A lot better.
Okay.
Thank you so much.
Great. I'm going to ask you to come in for a follow-up appointment in about a week from now. Okay, you can go to the front and make that with our scheduling office. So, but hopefully you'll start to feel better. I would continue taking the ibuprofen and go ahead, relax, dress on your own time, and we'll see you at the front.
Thank you so much.
Thank you for allowing me to do this exam.
Thank you.
Okay.